Hi, my name is Reagan Beckley, and the topic I chose for my pathophysiology paper is gastroesophageal reflux disease. Have you or someone you know ever suffered from a heartburn? While this is not an uncommon thing to occur, it's one of the few symptoms of acid reflux. Other common names for this disease include the milk and cookie disease and peptic esophagitis. Excuse me. However, the most common name for this disease is gastroesophageal reflux disease. GERD. GERD is a digestive disease where stomach acid or bile irritates the esophagus. When stomach acid or other contents of the stomach enter the food pipelining, irritation sets in and GERD occurs. There are different levels of severity pertaining to this particular disease. The severity level all depends on the competence of the lower esophageal sphincter. Along with the pressures on one or the other side of the sphincter, this disease is not considered life-threatening and can be treated with proper care and prevention. Along with chronic heartburn, there are many other symptoms associated with this disease. Someone who suffers from this disorder will undergo sour taste in the mouth, chest pain, and dry cough. They may also undergo regurgitation and dysphagia, among other things. In some of the more severe cases, one might find patients suffering from bleeding, narrowing of the esophagus, or a precancerous condition known as Barrett's esophagus. Even people who aren't diagnosed with GERD still suffer from acid reflux or the occasional heartburn. However, if any of these symptoms occur twice a week or more, you could be diagnosed with GERD. If at any point in someone's life they start experiencing similar symptoms to this disease, they shouldn't hesitate to contact a doctor. Having a disease comes with numerous doctor's visits and testing. With GERD, most people have mild symptoms which don't require labs. However, there are people out there who have severe symptoms or their symptoms are recurring after treatment. It's said that a barium swallow is the most common test in children. During this procedure, a chalky substance is swallowed and tracked as it flows down the esophagus. Once the substance is inside the patient, an X-ray is used to see where in the esophagus and stomach the barium has traveled to. One of the more common labs used in adult patients is an upper endoscopy. In this procedure, a small flexible camera is inserted into the throat. By doing this, the doctor can look at the esophagus, stomach, and the first part of the small intestine. Another test that could be ran is an esophageal manometry. This lab tests the pressure in the lower esophagus. A stool could be gathered from a patient to test for bleeding, or an acidity test can be completed. When someone suffers from a disease, the etiology is one of the most important details to obtain. Knowing the cause of a disease is extremely important for a patient who's looking to recover. Frequent acid reflux is the main cause for GERD. Another potential cause is delayed gastric emptying. In a healthy patient, the lower esophageal sphincter will relax as food and liquid pass through to the stomach. In a patient suffering from GERD, the lower esophageal sphincter will weaken or unexpectedly relax, allowing stomach acid and bile back into the esophagus. The typical heartburn duration for a person suffering from GERD is about 30 to 60 minutes. Many people have suggested that this occurrence has put a halt or disruption on their daily lives. Over-the-counter medications and lifestyle changes are all it takes to assist some people in getting rid of this disease. There are several different over-the-counter medications you could be advised to use to help with the discomfort. If someone chooses to use an antacid to neutralize stomach acid, they may be using something such as Tums or Rolaids. In other patients, stronger medications or sometimes even surgery are the only ways to lessen symptoms. Some prescription drugs that have shown to work slower but have longer lasting effects include a proton pump inhibitor or H2 blockers. Both of these work to decrease acid buildup in the stomach. As for lifestyle changes, eating healthier foods is one of the best things that you can do. Obese people tend to suffer from this disease, and simply losing weight and putting better things into their body could help them overcome the complications of GERD. Patients who suffer from GERD have a promising prognosis. Almost every person who undergoes a lifestyle change and takes medicine responds in a positive manner. Patients partaking in treatment should still continue the use of medicine to help tame their remaining symptoms. However, Some people can suffer from GERD and eventually overcome the disease. These people can completely heal and no longer have any complications or flare-ups. Patients who get help sooner rather than later have a better chance of obtaining the best prognosis. It's been said that starting treatment earlier not only helps people heal, but it makes it easier to prevent other serious conditions from arousing. As most people can manage the discomfort associated with this disease, some people have a more difficult time with it. When dealing with GERD, the biggest way to prevent it from occurring is by practicing a healthy diet. Anybody can do this by eliminating caffeine, foods with lots of fats, alcohol consumption, and smoking. They may also want to look into avoiding spicier foods and using heartburn medications. Two other ways someone could avoid obtaining GERD is through healthier sleeping patterns and some sort of stress relief. Try not to eat at least 2 to 3 hours before laying down at night. When you lie down, gravity pulls whatever's in your stomach toward your esophagus. The earlier someone eats, the earlier they allow for the stomach to digest food. The less food in one's stomach when they lay down means their chances of bringing that food back up to the surface dramatically decrease. Certain drugs, such as aspirin or naproxen, can stimulate symptoms of GERD. If you or somebody you know is in pain, you can substitute those medications for something like acetaminophen. As anybody can see, this disease is not life-threatening. Millions of children and adults suffer from this disease every year. Someone might see this disease in kids just as often as they do in adults. Studies are starting to show that it is more common among children than previously acknowledged. You probably even know somebody who's dealt with it. With the proper prevention techniques implied, anybody can conquer this disease. Taking care of eating habits and going to the doctor if you feel something isn't right will allow you to get this disease taken care of quickly, allowing you to continue with the daily activities of life. Thank you.